Today, there are no new cases of COVID-19 to report in New Zealand. However, our total number of confirmed cases today increases by 4. Let me explain. These cases are people who returned to New Zealand from the Greg Mortimer cruise ship back in April, 13th of April, and they had all tested positive for COVID-19 in Uruguay before they came back. They had been classified as under investigation while we were awaiting information from Uruguay to avoid them being double counted as part of the overall World Health Organization numbers. We've now confirmed with our counterparts in Uruguay that they did not report those cases, so we are. I should say all 4 of these people have recovered. For those of you who recall, actually we had added 3 of them to our total and then took 3 off. The 4th of these had also tested positive in Uruguay, but then upon arrival in New Zealand, when we tested all of those passengers, all 13 of them who returned off that ship, that 4th person tested negative and subsequently tested positive. So we have these 4 historical cases. We are now adding them to the New Zealand total to add to the World Health Organization total. I'm sure that is all very clear. I'm happy to answer questions on that later. But suffice to say, back to my original statement, there are no new cases to report, which is encouraging. Our total number of confirmed cases, despite there being no new cases, is therefore 1,153, and 350 of these are probable cases. So 1,153 confirmed cases, 350 probable cases, and the combined total is now 1,503. A total of 96% of all confirmed and probable cases have now recovered. That's 1,442, an increase of 9 on yesterday. There are just 2 people in hospital again today in Auckland and Middlemore hospitals. Neither are in ICU, and I'm pleased to say there are no further deaths to report. Yesterday there were a total of 3,125 lab tests completed, and the grand total is now 233,843 completed tests. As I signalled yesterday, overnight I participated in the opening session at least of the World Health Assembly that started at 10 p.m. New Zealand time last evening. In the opening session there were statements from a number of country leaders, including Angela Merkel, the German Chancellor, Presidents Macron from France and Xi Jinping from China, and all had the same theme that they were covering, which was strong support for global cooperation in the response to COVID-19. The WHO Director General Tedros also spoke at the beginning of the meeting, and as part of his address, and it's public and some of you may have already seen that, he announced that he intends to initiate an independent evaluation of the COVID-19 response to develop recommendations that will help improve national and global pandemic preparedness in light of the COVID-19 experience. The timing of that evaluation is still to be announced, and a number of people who commented in that opening session did point out that it is important we do this review or evaluation. However, it is also important that the WHO and member states are not distracted at this point from their efforts in responding to the COVID-19 pandemic, but the Director General did indicate it would be undertaken at the earliest possible moment. Our strong focus remains on fighting the pandemic now, and we will of course contribute as we can to the evaluation when it commences to ensure we both learn and are able to share our experience. The meeting is about to pause and will be reconvened again tonight, and the resolution on COVID-19, which is a lengthy and substantial resolution that has been agreed by consensus by all WHO member states, will be considered again when it reconvenes. Today is World Family Doctor Day, and in New Zealand we don't tend to call our GPs family doctors, but I would like to shout out to around 5,500 GPs in New Zealand for the work they do day in, day out, and of course for the magnificent role they have played along with their colleagues as part of our response over recent months to the challenge of COVID-19. We've seen them fully involved in the swabbing through CBACs or in their own practices, and also adapting very quickly to be able to provide care to people under alert level 4 virtually using either video or phone calls. And finally, the Prime Minister announced yesterday the launch tomorrow of an app that will be part of our ongoing efforts around contact tracing. It will be available for download tomorrow, and I'll provide some more details about it at tomorrow's press conference.